Hi, welcome to AV Chiropractic Health Center. My name is Dr. Wayne Hodges. Along with my colleagues, Dr. Jeff Williams and Dr. Rick Duenas, we welcome you to this little office tour video to give you an idea of what you can expect when you come into the office. This is our reception area. As you can see, plenty of room here. Generally, when you come in, you'll sign in, and one of our helpful staff will get you started with any paperwork that you haven't filled out already. And once you do that, then we're going to come in the back here and get you in an exam room to meet the doctor and go through a consultation. So let's head back here, and I'll show you the rest of the office. You can see we have exercise equipment. I don't know if it's going to show up, but we have exercise equipment there as we head down the hall. These are two wobble chairs that we use for low back rehabilitation. These help to mobilize the lower back. These seats actually rotate and move. So by sitting on those and moving, you're able to really get some fluid moving into the disc and create some mobility, warm up the tissues before we continue the rehab process. We have a cervical or a neck traction device used over the door here, again, to warm up neck muscles, stretch them out a bit before we start therapy. Usually a lot of people will start, this will be their first station when they come into the office. Okay, so we're going to head in here. Let me show you. This is our chief exam suite. This is generally where you will meet the doctor, either myself, Dr. Duenas, or Dr. Williams. Basically, this is where we'll take your history, your family history, the history of your problem, really try to figure out the source of your pain or your symptoms or whatever's bothering you at that time. And we'll do this by really looking at three major areas. One is structure. The second is neurology, because pain is in the brain, actually. That's where it's generated. So you look at posture, structure, neurology, and then metabolic issues too. Is there any underlying conditions that can be contributing chemically, biochemically to your problem? So we'll look at nutritional or organ type questions also. So we'll take a complete history, and then we'll do a complete neurological examination from head to toe, basically to make sure the things that we can detect, usually easily detect as far as neurological function, we'll test all those, whether it's sensory, motor, mental function, and your posture and contour, and how the spine and joints are moving. All of that will be tested in here. Once we do our initial evaluation, then we would go inside, take any necessary x-rays if that's needed, and we'll look at that when we get down there. So this is our chief examination suite. We also do some therapy in here sometimes. Okay? Then we head down the hall. We have an exercise room in here where we teach people how to do rehab exercises, floor mats and balls and foam rollers and things like that. And then in here we have a massage room where a massage is going on in place right now. So there's we have a couple massage suites here that we use. Then in here, basically this is another treatment examination suite that we have. Basically same thing, we'll sit down in here, do a consultation, examination. We'll also do our bioimpedance analysis. Bioimpedance analysis is really a way to measure your body composition. It allows us to measure 5 body compartments: your metabolically active tissues, which is your muscles and organs, your water content, how much water is inside the cells, how much water is outside the cells, your bone, and your fat mass. Okay, so by taking those measurements, we know exactly how many calories you should have, for how much exercise you plan on doing, for what your weight goals are, what your blood sugar is, what your cholesterol is. All those kind of things will come into play so that we can figure out a nutritional program for you if we have metabolic issues or biochemical issues or nutritional issues that we want to handle with you that are part of your problem. Okay? Then we'll go through here. We have another exam room that we have. In this exam room, again, is another place, because we do have 3 of us and we do run a fairly busy practice. So we want to make sure you're not waiting in that reception area for too long. So this is another exam suite where, again, we'll do all our diagnostic workup, take your history, figure out what the source of your problem is and whether we can help you or not. Okay? If we can, then we're going to proceed into here, and we're going to do, this is our exam suite, our x-ray examination suite. In here we'll take any necessary x-rays. We can take x-rays of pretty much any joint or any bones in the body that we need to figure out what the source of your problem is. We take care of a lot of people with foot, ankle, knee problems. We also do, sometimes we'll take orthotic type testing on an examination if we find that there's a problem as far as your feet that could be causing a knee or back or hip problem. Then there's casting that can be done to correct that so that we make devices for the feet, orthotics. In here we can take x-rays of all these different body parts to figure out what the cause of the problem is. We also do an examination using digital camera where we take pictures called a posture print, where we take 3 pictures, one from the front, one from each side, and then that is put into a computer program to give us a 3-dimensional image of your posture. We put that together with your x-ray to figure out, number 1, what kind of exercise you need to do to correct it, number 2, what kind of traction you might need to do to correct it, and number 3, what kind of adjusting. By doing that, then we can improve posture, which is really important in improving how your body handles gravity, so that we're sending the right information back to the brain. Okay, so I'm going to go inside here. Pretty much that completes the tour of this half of the office. We're going to head back out. Here's our gym area. This is where we do some of our physical conditioning. We have aerobic equipment out there in the hallway, and this is our gym where we have strength training equipment. We do personal training here in our office. We have a personal trainer that works with us, so we can give individualized exercise programs. This allows them to increase muscle, decrease fat, increase flexibility and balance training, so that again we make you as stable as possible so that you're able to continue to move the way you need to move. Because moving is it's really what we're about, moving without pain. If we can move without pain, we're going to have a better quality of life. Okay? So we're going to head back out through the reception area now. And I'll take you into where the doctors do most of our work. Again, it's Christmas time. We have our little Christmas tree here. This is our treatment suite here, where we do most of our work during the day. Basically, we have our adjusting tables, multiple different kinds of tables, because no 2 patients are alike, so we don't fit patients to a technique. We basically try to fit technique to what a patient needs, because we treat children, young athletes, to geriatric patients who, I think our oldest current patient now is 94 years old as of right now. But these tables are kind of unique. I'm probably the only doctor, I believe, in this area that's a certified chiropractic biophysics practitioner, which is a secondary certification in postural correction. And we use these tables, which really do kind of all sorts of different things. They go up and down, they move. Depending on the position we need to put the patient in, these tables can be altered so that we're doing the best possible correction for that individual patient. Even the headpieces do move up and down, and they actually rotate back and forth also. Up and down, basically back and forth. Depending on what we need to do for the patient, we can do a bunch of different things. These tables here actually we're able to distract or stretch the spine to help treat lower back disc problems here. Okay, so pretty much we'll do our work. We'll use manual techniques where we use our hands. We'll use the tables, what we call drop table type techniques, where the tables drop. And we'll also use instrument type adjusting, where you can use little tools basically to work on an individual with a lot less force and with a lot more precision and still get great results. Okay? Then in here we have our traction setups, some of our traction setups to help change posture. Because to change posture, you have to do at least 3 different things. One is exercise, the second is traction, the third is adjusting. By combining all 3 of those and doing them over a period of time, we're able, when we take your x-rays, if we see an abnormal posture, we'll describe it to you, tell you what's going on, how does it contribute to your pain, okay? If we choose to correct that, down the road as we go through our treatment program, we want to see that that changes, okay? So we do take another picture at the end to make sure we got the change that we want. So these are used for different kinds of postures. We have standing traction, what we have compression extension traction, we have lumbar traction, we have roller tables, intersegmental type traction to mobilize the spine. We use ice, heat, ultrasound, we'll show you on the way out, and electrical muscle stimulation. We also use upper body ergometers to stimulate brain function. Arm motion will stimulate brain function, especially back part of the brain that controls your posture, movement, and coordination. So we'll use that too with people. As we head out here, basically this is another traction area. Here's one of our machines that we do ultrasound or electrical muscle stimulation. We'll do even light therapy, like low-level laser type light therapy. These traction setups are really to correct neck postures. Okay, if curves aren't right, we can use different combinations of weights and traction to change the shape of a person's neck, or what we call cervical spine, so that if we can prove that, we can prove the way they carry the weight of the head. If we can do that, then we take long-term stress off and their problem doesn't recur as often. Okay, that's really what we try to do. Over here, and I don't know if we could get a good video of this because of the light, but let me shut this. Basically, we have a machine called an ATM2, and what this does is it helps to basically improve range of motion, pain-free range of motion, a lot quicker than we can not using this machine. So we employ this quite a bit in our practice. We also have a decompression type table that we use to on low back discs to try and decompress those so that we can take the pain, the pressure off those discs, and really help someone who's trying to avoid surgery. We're able to get rid of that chronic back and leg pain. Okay. So anyway, I just want to thank you for taking this tour.
Okay, great.
And we look forward to seeing you here in our office for whatever your needs may be, whether it's fast natural pain relief or if you've had chronic pain. Really trying to figure out what's the bottom line. Why do you have that chronic situation? What can we do to make that better? If you have any other chronic underlying conditions like fibromyalgia or thyroid problems or metabolic problems or even some autoimmune type issues that require a lot of nutritional or lab type testing, we'll do that too to make sure we get to the bottom line of what's the cause, or what are the multiple causes to your condition. So we look forward to helping you in the future, and thanks for taking the tour.